Let's talk a little bit about the domains of self-care. So there's all different ways that we need to care for ourselves, but there's really the physical part. And I like to think about that first and foremost. And one of the first things to go when you're a caregiver, I feel like, is that physical part. You're like, sleep, what's that? I'm in a hospital, or I'm in a clinic, or I'm up doing research at night to try to find this clinical trial, or I'm emailing these doctors and I'm doing all this. Like, what sleep, right? Sleep is so important. Like, if I could give you anything about something that you could do to take care of yourself, work on your sleep. And I talk to literally every patient and family member that I meet about this, no matter what sort of thing they're working through. But if we are not sleeping, then everything else is harder. Our emotional regulation is harder. I mean, everything. And so, our compassion, our ability to reason, everything. So if you take anything out of this, one thing that I would give you or leave you with would be, how can you either improve the quality of your sleep, improve the number of minutes or hours that you're sleeping, and how can you work a little bit on your sleep? And so that is a huge, huge, huge thing. How we're nourishing our body, also really important, how we're fueling our body, and then if we're moving it and how we're moving it. Because all of those really can support our emotional health, how we show up with our family, how we show up for the patient, our child. And so that's really kind of the groundwork, is the physical part. And again, that's the first thing to go, because we're pushing it to the limit, right? Like, we're pushing it because we need to show up for someone else. And we will not be able to sustain that for very long over time. And I don't know who to attribute this to, but it was like, if you are not resting your body will force you to rest. And really the way I think about that is, if you are pushing so hard, then eventually you're going to get sick, or your body's going to force you into some sort of rest. And I see that time and time again, in small ways, maybe with getting a cold or whatever, and then in large ways, sometimes with other sorts of illnesses. Okay. Emotional support and ways to take care of yourself. Certainly acknowledging emotions, saying, this is hard. I'm feeling these sorts of ways. Seeking support, ways of taking care of you. And I split out emotional and mental, because some of this is, emotions are not good or bad. They are what they are. They come up. We don't necessarily control them. Mental things with like thoughts and boundaries that we may have, we have a bit more control over thoughts. We don't have as much control over emotions. People can talk to me about that, but they just come and they change in intensity and they go and they come. But our thoughts, we do have a little bit more control over. And so that's kind of why I separated those out. That's a way that we can kind of also take care of ourselves. And then social, certainly, because those are more external things. And then our own spiritual health is a way of taking care of ourselves as well. Okay. So let's talk about micro moments of self-care. Okay. 1 to 5 minute resets really can have positive impact on our overall health. It does not have to be 30 minutes of meditation. It can be, and that would be lovely, but it doesn't have to be. 1 to 5 minute resets multiple times a day can really impact and be positive. Small actions matter, and they build on one another. And so certain really quick micro moments might be stepping outside and focusing on one of your senses, right? So even if you're not a nature person, you can, being outdoors, getting fresh air, being outdoors has some really significant positive impacts on our mental health and our physical health. So stepping outside and maybe listening to what you hear, or stepping outside and just focusing on what you can see and just being aware of it for a minute, 2 minutes. Drinking water slowly, mindfully drinking a beverage, savoring coffee, whatever that might be, instead of just guzzling it down to try to stay awake because you didn't sleep last night. I've done that many times. Maybe taking 3 deep breaths or doing a guided breathing or something like that. Those are all some micro moment ideas. So I will leave this here, and I'm recognizing time, and I want to make sure I can allow for questions. But I after this, you might want to consider or think about what helps you personally feel even 5% better. What might help you feel even 5% better? And maybe reflect on that, maybe write it down, maybe put it in a note on your phone, and then think about that. And maybe you don't know yet, so you try some of these micro moments on for size and see what you might think.